I'm Jennifer Lepard. I'm the president and CEO of the Alzheimer's Association in Michigan. And I am so happy to have today with us Caraline Coates, who is the vice president of the Bold Goal and Population Health Strategy at Humana. Caraline, thank you so much for taking the time to join us today. We're so excited to talk to you. I hope you're doing well in Florida.
Yes, thank you, Jennifer. Nice to be here today, and we dodged a hurricane recently, so doing well. Thank you.
We definitely are full of challenges this year, I think, everywhere on every front. So I'd like to just start. Some people who might be watching this might not be as familiar with Humana, and like to just start with you describing a little bit about what your company does.
Of course, yeah. So Humana is a health and well-being company. We offer various products in the Medicare Advantage, Medicaid, commercial employer group lines of business. We're really focused on fostering an integrated care delivery model that really looks at going upstream around individuals' health, understanding their whole person health needs. I've been with Humana about 13 years, and currently in the Bold Goal work, that's largely what we're focused on, is really trying to make health easier for our members to achieve their best health, improve their experience, focus on their outcomes, but look beyond just their diagnosis and what are their whole person health needs, and trying to remove those barriers in their life.
Can you tell specifically a little bit about what programs that you offer in Metro Detroit?
Yeah, so Detroit is my hometown. So while I live in Florida, it's a special place in my heart. That's where all of my family still resides. And so I'm excited to say that just this past year, we designated Detroit as a formal Bold Goal market. And that really means there's a commitment there by Humana leadership to really dedicate the resources, understanding what are the different community-based organizations that we need to employ and build relationships and trust with to create the resources for our members to achieve that whole person health that I was mentioning. So we're currently getting a lot of work off the ground around addressing things like food insecurity and social isolation and loneliness. We're interacting with a lot of these community-based organizations to put together a health advisory board. So it's not Humana saying what we think is important and what we think are the barriers to health, but it's really listening to the community. And this all started pre-COVID, right? So now we're looking at it from a lot of different angles, recognizing that barriers to achieving health are magnified in so many ways, and really listening to the community is where we're really focused right now, and understanding what interventions do we need to invest in to provide the right healthcare resources, both clinically, socially, from a mental health perspective, to meet, again, those whole person health needs to the Detroit community and the population there.
Well, I think, one of the things that we're really excited to be partnering with Humana is that it's certainly a mission of ours as well to address health disparities in the communities in which we serve. It's certainly been magnified by what's been going on with COVID. Can we talk a little bit more about kind of how you see COVID impacting things, and maybe even some more details just about the gold market strategy and really what that effort entails and how that's going to affect the residents in our community?
Of course, yeah. So the Bold Goal, that it was started back in 2015 by Humana, and it really was how do we improve the health of our members and the communities, right? It really beyond what an insurance company might traditionally do. So we're on this continual evolution of transitioning from an insurance company with elements of health to really a health company with elements of insurance. And I personally believe this goal around improving the health of the communities we serve is kind of the catalyst or the engine for that, right? And so it's getting deep within the community. Healthcare is local. So the barriers that people in Detroit may have to accessing healthcare are different than perhaps where I live in South Florida, or where Humana is based in Louisville, Kentucky. And so truly listening to the community and to our members and convening and building that collective impact is really where it starts, and kind of building that foundation. And then we measure the healthy days. We make phone calls to our members. We ask them how many. We use the CDC Healthy Days tool, which is really grounded in about 4 simple questions. 2 of them are around how many days in the last 30 days have you felt physically unhealthy? How many days have you felt mentally unhealthy? And those are really kind of gateway questions to understand what's going on in someone's life beyond perhaps their clinical diagnosis. So we track that over time. We look at impacts on that. For example, I live in South Florida. We've seen the unhealthy days really spike up during hurricane season, right? Just the anxiety that creates. So we are studying the impact on healthy days right now, pre-COVID, during and post, when that will be during re-entry, and how that's impacting people's health, right? I think it's easy to get focused on your clinical diagnosis and the clinical resources, but we all, I think, are experiencing the effects of being isolated socially, loneliness. Even if you weren't food insecure before, maybe leaving the house right now, right, causes some feelings of anxiety and getting to a store. So what are those barriers that our members are experiencing, and what companies do we need to partner with, whether it's around meal delivery? There are transportation services we're looking at where we can employ a grocery card benefit that we're testing. So all those kinds of things that, again, are about really understanding the whole person needs. So the bold goal was really rooted in making health easier and improving outcomes, and it still is that, and we're just continuing it to additional communities, and Detroit is among our newest. So we're just getting off the ground there with it, but we're excited to take the learnings we've had over the last 5 years and get some momentum there.
Well, great. We're hoping that we can be a partner with you in that effort here. It sounds very exciting.
Absolutely. I mean, the Alzheimer's Association does such great work, and sadly, this is not a unique diagnosis or a rare diagnosis. My mother, 81 years old, has Alzheimer's, so it rings very true to me, and really is relevant in the importance of whole person health, and not only on the person with Alzheimer's, but also the caregiver and the care partner and the whole ecosystem around that person. And so we're excited to partner with the Alzheimer's Association there with you, and understand how we can perhaps work differently together to meet those whole person needs.
I think that it's been magnified even more by what's happening with COVID. We've got 190,000 people in Michigan living with Alzheimer's disease, upwards of 600,000 caregivers. And I know, it's the 6th leading cause of death in the country, and it's the only one in the top 10 without a cure, prevention, or a treatment. And certainly this population has been so hard hit by COVID. People, I think, are very focused on COVID and so many other things that are going on. But those people have been some of the hardest hit, even not only the ones that are in assisted living facilities that have been at much higher risk of contracting the disease, COVID, in addition to Alzheimer's, but just the things that you've talked about, caregivers and increased social isolation for not only the person living with disease, but the caregiver. They might used to have somebody come in their house to help out that they haven't been able to. So it's really been a huge strain. And I think, some of the things that you've talked about in your initiative in terms of looking at how people are being impacted medically beyond a clinical diagnosis is really coming to the forefront in COVID. So I think it's really exciting work that you're doing, and we're happy that Detroit is part of that now.
Yeah, absolutely. And I think we have to be really nimble in the solutions that we're looking at as we're experiencing during this. Some of what we were really excited about doing pre-COVID, we've had to change a lot, right? So we've invested in some companies. We're piloting with one called Papa, and their tagline is grandkids on demand, right? And this is where they employ and contract with college kids who will make social visits in people's homes. And I just thought that would be wonderful to have someone give my dad a little bit of respite, go to their house, play the piano with my mom, be another set of eyes and ears. And with COVID, that whole pilot had to pivot from being in person to telephonic, which is still serving a great need, but taking the learnings and benefits of that, and how can we continue to evolve that to meet the needs given the restrictions that we have. So.
That's great. So walk season is upon us, and I know that a lot of individuals are thinking, wow, you guys are still having walk, but we are. We are just going to be walking everywhere, as we say. We're encouraging people to walk in their neighborhoods, in their local communities, with their friends and family, the people that they're comfortable with in this. And we know that Humana has been a longtime supporter. We know that you guys did the Memory Wall in Detroit in 2019 and 2020, and you were a general event sponsor. And Laura Garman has been our representative in the Promise Garden in 2019, which was great. Can you tell me a little bit about why Humana has chosen to be a supporter of the Walk to End Alzheimer's?
Of course. I mean, you mentioned the prevalence, right? Not only on the individual, but the community of that person. And so there's such a high prevalence in people that Alzheimer's affects. And you also mentioned there's no cure, there's no treatment, right? So instead of focusing on trying to solve something clinically, there's so much we can do from a social health perspective for that person and for the community. So raising awareness is huge. We really believe in fostering education and resources around that. Laura Garman's been fabulous. So she is our bold goal leader in Detroit. We're really excited to have her take what she's already been doing with Alzheimer's Association and taking that through in a leadership way with Humana. So it's the right population, right? I mean, our bold goal is about improving the health of the communities we serve. And with that prevalence of not only people, but their families and their loved ones and the circle around them, we just feel like it's a very impactful part of the population that maybe we can make a small difference in improving their health.
Have you, one of the things as we're talking to various businesses and community partners is, walk is going to be different. We can't get together in person this year, but we're encouraging people to walk. Is there a plan at Humana or in your personal family in terms of how you're going to participate and walk this year that you want to share?
Virtually, right? So I think I think we're all more accustomed to doing things virtually, and there is a sense of community, right? So we'll absolutely all participate. There's a time, we're going to sign up and kind of join. So I have 4 sisters, and so we have a big circle of community with our extended families around my mom and dad, and so that's something that we all do together. Here I am in Florida, right? So there's kind of a silver lining there that this isn't the only, I can't be there physically, but nobody really can. So there's a deeper sense of community that we can kind of strike virtually. And then in Humana, we do a lot of internal, just among associates. There's a lot of our associates who live in the Detroit area and their extended families who we kind of advertise to participate in this to any extent that they can. And we have network resource groups internally that we also kind of promote this, not only for people who know people with Alzheimer's, but caregivers in general. And so being able to give an avenue like this for associates to participate in certainly gives kind of a sense of purpose and well-being that spreads pretty quickly. So while we have to pivot from doing it, actually in person, I think it actually extends its reach a little bit in this pandemic world that we live in.
We agree. Looking for the silver lining, I think people have an opportunity to walk with their friends and family wherever they may be. So we really appreciate the long-term support of Humana. We're so excited to have the new initiative in Detroit and look forward to working with your staff on that. And just want to thank you so much for joining us today and sharing the information about your work and your support for WALK. Is there anything else you'd like to add before we close up?
Just to thank you for the partnership, right? I mean, the bold goal is not about Humana. It is about community organizations. It is about the people. It is about understanding what are the barriers to health. And so just having this relationship that I think can be so widely impacted and us working together is really exciting. Detroit obviously has a special place in my heart. Alzheimer's has a special place in my heart. And so being able to have kind of all that together is both a personal and professional reward for me to be a part of. So thank you for your collaboration.
Well, thank you. And thank you for everything that you do. And thanks again for joining us.